You're listening to your host and psychotherapist, Rhonda Spaziani, on Spaz on Mental Health on greeninkradio.com.
Are you listening? He's repeating the words that came out of her mouth. Listening.
Hi, this is Rhonda, and today's topic is what is abnormality? So what is abnormal in psychology? Over the years, there have been many terms have been used to describe people suffering from mental health issues or illnesses. Crazy, insane, disturbed, unbalanced, or mad. And what's the difference, though, between abnormality and just plain old eccentricity? What is a symptom of psychopathology versus oddness? Eccentrics actually live very full lives and overall are more content than the general population, my friends. So the message is, go be your authentic self. I'd like to give the example of tattoos. So 40 years ago, full arm sleeves, neck, face tattoos would have been considered totally abnormal, that this person probably was suffering from mental illness. 10 years ago, you might have been considered eccentric, right? But now it's almost kind of the norm. So see how society changes on its definitions, and that's what makes defining abnormality so difficult. But the gold standard generally is the 4 Ds: deviance, distress, dysfunction, and danger. It's deviant if it's different, extreme, unusual, or bizarre. It's distressing if it is unpleasant or upsetting to the person and to the people around them. It's dysfunctional if it interferes with the person's ability to carry out daily activities in a constructive way. And it's dangerous if it causes harm to self or other. But that's where some of the stigma comes in, because usually people that are suffering from mental illness are not dangerous. It's very difficult to define abnormality because every society has its own norms of abnormality. So there's 2 main approaches that emerged from thousands of years of theory. The first one is it views abnormal behavior as a deviation from social norms. And many psychologists have stated that abnormal is simply a label that's given to a behavior which is deviant from social expectations. Abnormal behavior, thoughts, and emotions are those that differ markedly from a society's idea of proper functioning. And each and every society has its own norms, stated or not stated, rules for proper conduct. So behaviors, thoughts, and emotions that break any of those norms are then called abnormal. Not so great, right? The second approach views abnormal behavior as maladaptive. Many psychologists believe that the best criterion for determining the normality of behavior is not whether society accepts it, but whether it fosters the well-being of that individual and of the community around them, right? So well-being is not simply maintenance and survival, but also includes growth and fulfillment. Let's look a little bit at the historical background. Abnormal behavior has been treated and assessed since the beginning of time. And originally it was considered that it was evil spirits or the devil, and so they did exorcisms, torture, trephination, where they drilled into these poor people's heads with no anesthesia, I can't even think, to release the evil spirits. They believed that the health of the body and mind was controlled by good or evil spirits. And so if someone was suffering from severe depression or schizophrenia, evil had won. And so they had to release that from the body in whatever ways they did it, by torture, trephination, exorcism. And so then around 500 BCE to 500 CE, in came the Greek and Roman views, and Hippocrates was considered the father of modern medicine, and he believed that the causes of mental illness were internal rather than external, and they were around these 4 fluids or humors: yellow bile, black bile, blood, and phlegm. And in order to the treatments to rebalance these fluids that got out of balance were warm baths, massage, bloodletting, not so much now, but a lot of the stuff he recommended still is mechanisms we use for treatment now for people to center and reduce stress. And he also recommended a quiet life, vegetarian diet, temperance, not drinking that much, exercise, celibacy, and the bleeding, not so much today, but all the rest of it, yes. And his Hippocrates theory is very similar to the Indian notion of the 3 doshas of Vata, Pitta, and Kapha, which were mentioned in the Arthavada Veda and the Ayurvedic texts. So there's some overlap here. And so Hippocrates and group then thought of it as biological, organic, or somatogenic approach, and that comes around again in modern times. And then another approach is the psychological approach. And according to this view, psychological problems are caused by inadequacies in the way an individual thinks, feels, or perceives the world. It's also called the psychogenic perspective. And Sigmund Freud, who was the father of psychoanalysis, and Mesmer, who started the whole hypnotism movement, believed in this psychological approach. So there was 3 perspectives, basically: supernatural, biological, organic, and psychological. These have recurred again and again throughout the history of Western civilization. During the Middle Ages, 500 to 350 CE, about 900 years, Rome declined and back comes demonology. The church gains power. There's a bubonic plague. There's war. The Catholic Church is in power. They reject science. And back comes demonology and exorcism, torture, and internment in hospitals. By the end of the Middle Ages, the Renaissance period comes around, the Age of Enlightenment, which is 1400 to 1700, and humanism starts to become more in favor, and promoted by the German physician Johann Weyer, who was the first mental health physician ever. And he believed that the mind was susceptible to sickness, just like the body. And he brought a very humanitarian perspective, and he thought that people had psychological disorders, and witches weren't witches. They were suffering. They needed medical, not theological treatment. And he's considered the founder of the modern study of psychopathology. During this time, it was the age of reform. There also asylums were brought around in Europe and America. And in the 19th century, the reform and moral treatment approach continued. Philippe Pinel is a French physician who pioneered the humane treatment of the mentally ill in France, and William Tuke was an English tradesman who also pioneered it in England. And Benjamin Rush and Dorothy Dix were the people that pioneered the humane treatment here in America. And these humane treatments dominated during this time, but at the end, by the early years of the 20th century, it was like 1900s, that all went out the window again, and hospitalizations and internment then became the norm again. And unfortunately, then people were put into long-term hospitalizations, and it didn't go well. And then the somatogenic perspective, the biological, and the psychogenic perspectives kind of interwove again throughout this time, and they attribute to the rise of the psychogenic perspective to Friedrich Anton Mesmer, who you got to read about him. He's really interesting. Just Google him, but I'm not going to spend that much time here with that. And Sigmund Freud. One of the big advances that happened was in the 1950s when psychotropic drugs were discovered. And so their antipsychotic drugs, antidepressant drugs, and anti-anxiety drugs brought a whole new life to many people that would have been, just hospitalized for their whole entire lives. And that really changed, these psychotropic drugs really changed the face of hospitalizations in America, these state hospitals that were created. The inpatient populations in 1955, just in public psychiatric institutions, was 600,000. In the United States. Today, there are less than 75,000 patients in public institutions. Kind of created some other issues, though, because with these drugs now, the state hospitals don't exist really in the way that they used to, and so people that have severe mental illness often don't really have a place to go. There's supposedly this community model that doesn't seem to be working 100%. There's estimates that as many as 144,000 individuals with chronic mental illnesses now live on the streets, and another 440,000 are incarcerated in jails and prisons across the country because they're not getting the treatment that they want. So the drugs brought some really great stuff, but they also kind of push people into the street and into jails when they might have gotten some treatments. But hospitalizations were not, and hospitals did not treat people very well prior to, in the 50s and prior to. So it's kind of like both were bad. Both weren't great solutions. And then there's also a growing emphasis on preventing disorders. So the new trend is trying to prevent disorders and promote mental health. So community programs help individuals at risk for developing emotional problems, a more preventative, proactive model with health insurance, more health insurances covering behavioral health programs, and then technology and mental health. That too is a double-edged sword because there's internet addiction, decline in attention span, increased numbers in depression and anxiety as a result of his increased time on social networking sites and comparing ourselves constantly with other people and interacting less actively in real time with real people. But then there's also the good side, which is the emergence of telemental health, which makes it very accessible to people that have maybe transportation issues. And then COVID-19 pushed telemental health into the mainstream, and that's kind of become more of the routine way that people are accessing mental health since COVID in 2020. Nowadays, too, therapists are looking at things as a more global way, a holistic way, and it's called the biopsychosocial approach. They don't look at it just from a biological point of view. They don't look at it from just a psychological point of view. They also look at it from a social context point of view. And so you look at it, you treat the person holistically, because all of those factors contribute to, because in the past, the biological models or the psychological models or the social models didn't really hit it all, but the biopsychosocial models tries to incorporate and encompass the whole person. And then the question is asked, how do we even know if someone has a mental health issues or a diagnosis? There's the classification of psychological disorders, which is called the Diagnostic and Statistical Manual of Mental Disorders. It's now in the 5th edition, and it's had an addendum in 2018. It's DSM-5. And this is a reference handbook that the American Psychiatric Association, the APA, publishes. And it's a tool and a reference guide for mental health clinicians to diagnose, classify, and identify these mental health conditions. And I think it's up to about 157 mental disorders with symptoms, criteria, risk factors. But it doesn't include treatment guidelines. And but it does go into even specifiers about severity and onset. So it's very interesting to read. Just know that reading it does not make you a clinician. You really have to get trained on that. So what is abnormality? Have I described it? Have I explained it to you? Do you feel you know a little bit more about what is abnormal? And if you don't, that's okay, because it's really difficult to define what is abnormal at any given time. It changes with society, what that society deems is abnormal, and how we view abnormality through our lens. Believe it or not, 43% of respondents today believe that people bring mental disorders on themselves. 31% consider such disorders to be a sign of personal weakness. 35% believe the disorders are caused by sinful behavior. And 33% are afraid of people with disorders. But it is getting better. There's better medications, there's research, more treatment. Most clinicians agree that large numbers of people need treatment, and more so since COVID. And around 43% of people with psychological disorders in the United States do receive treatment in any year, and at least 20% of clients enter therapy because of milder problems in living, maybe marital, family, jobs, peers, school, or community relationship issues. Outpatient care is primary right now. There's less expensive outpatient settings. Outpatient treatment is becoming more and more available for more kinds of problems. And then programs are getting created to devote exclusively to specific problems, not just throwing people in these back wards in hospitals. And the digital world is both a cause and a cure, so it's a little different. And there's a ton of enormous amount of web-based misinformation, so be very careful. If you want to be looking something up, the DSM-5 is a gold standard, but unless you're trained, you really shouldn't be diagnosing anyone. So, what is abnormal? We're going to keep on trying to find out. Tune in next episode, because we're going to discuss what are the models of treatment. This podcast, as all podcasts, is sponsored by Green Ink Marketing and Communications. You can find them at greenink.us.com. They bring your stories to life.
Music provided by Immunuri. Check them out at imunuri.com. Thanks for listening to Spaz on Mental Health. Tune into greeninkradio.com to listen to other great shows hosted by a collective of imperfect gurus. greeninkradio.com, an experience for the curious mind.